Hi, my name is Dr. Jeff Hester. I am an astrophysicist, professor emeritus in the School of Earth and Space Exploration at Arizona State University. What I do these days is I work with individuals and organizations, helping them think strategically in the face of very rapid change. And wearing that hat since the outset, I have been paying very close attention to what's going on with COVID-19. I also have deep, long-time ties with the education in Arizona. Right now, my wife is an elementary school principal in Mesa. We have a 10-year-old daughter in that program. We have two grandkids in Mesa. Going way back in Gilbert, I chaired a bond override committee to build a bunch of schools. I co-chaired a capital override committee. I have a long history of involvement with education. And I find just at the moment all of that kind of coming together. Long and the short of it is that I have been watching the planning going on for what schools are going to do in Arizona in August, and I'm concerned. And my concern is that the assumptions that people are making about what the circumstances will be in August are just not correct. A lot of very good people are putting a lot of very good effort into thinking about how schools might open. But in so doing, they tend to be assuming that conditions in the fall are going to be more or less like conditions are right now. This is, June 24th. Dates matter right now. And that assumption is just not correct. We are in a very rapidly changing situation. And August is not going to be anything at all like what we're seeing right now. Now, it can be hard to know what the future is going to be like. To get there, what you have to do is you have to take a hard, realistic look at what things are today, what the trends are, what's known, try to think through it. But when you talk about COVID in Arizona right now, really it's not that difficult to understand what the future is going to look like at all. And there's nothing good about it. The trends are clear, and we're pretty much locked into the path that we're going to be on for the next while. Everybody has seen plots like this. This is just showing kind of where we are right now, looking at the number of new confirmed COVID cases every day in Arizona. To provide a little bit of context, when Arizona had its shelter-in-place order back in late March, this is where we were. And the shelter-in-place order, schools closed back in here somewhere, shelter-in-place order, all of that together managed to kind of smooth things out. They've been coming up since then, but all in all, it's remained reasonably flat until the middle of May. The shelter-in-place order was lifted. And what you saw there was about 2.5 weeks later, cases started going up and started going up faster and started going up faster still. That is exponential growth. Right now, COVID-19 is spreading exponentially in Arizona. Now, exponentially, what does that mean? That means that each time step, you don't add a certain number of new cases. Rather, you multiply the number of new cases by some number. So exponential growth works like this. You start out with 1, multiply by 2. It's like, the old commercial. The actress is selling shampoo, and she says, I told 2 friends, and they'll tell 2 friends, and so on and so on. You go to 1 to 2, you go from 2 to 4, you go from 4 to 8. Okay, not a lot has happened. The numbers are still fairly small, but the numbers start getting big in a hurry. 16, 32, 64, 128. That's what exponential growth does. Exponential growth, it seems like, there's nothing really going on until all of a sudden things seem to be increasing impossibly rapidly. That step, the amount of time that it takes for things to double, is called the doubling time. So to go from 1 to 2 takes a doubling time. To go from 2 to 4 takes a doubling time. So on and so forth. I've been looking at the data for the doubling time in growth of new cases around the country. And this is a plot of that as it stands right now, just kind of the last couple of weeks. To look at this plot, as you go down, you are going to shorter doubling times, which means that you're going to faster growth. And so if you look at that, Arizona right now has a doubling time for new cases, new daily cases, of about 7 days. And what that means is that however many new cases you get today, you can expect to get twice that many new cases 1 week from now, and you can expect to get 4 times that many new cases 2 weeks from now, and so on and so forth. Exponential growth. 2,500 cases today, 5,000 cases in a week, 10,000 cases in 2 weeks. Things get bad in a hurry. Such is the nature of exponential growth. Now, it might be easy to say, oh, gee, that could never happen. But in fact, it does. This is, in fact, how pandemics behave. You can look at New York, for example. New York went from 1,000 cases per day to 11,000 cases per day in just 2 weeks. And we are on a very similar trajectory. Another thing worth noting is it's not just Arizona. There are a lot of states in the nation that are in trouble. And in fact, the United States as a whole has a doubling time for new cases of only 20 days. We could talk about that. Everything that I'm going to talk about today, Arizona is kind of on the leading edge of. We're seeing this happening around the country. One of the things that people have talked about is, well, gee, maybe things will slow down in the summer. I should point out that they haven't. When you look at the states that have the fastest growth right now, the shortest doubling times, Oklahoma, Arizona, Florida, Texas, some of the hottest states in the nation, and those are in fact the places where COVID is spreading most rapidly. It's actually probably not surprising, because in places where it's hot, what people do in the summer is they stay indoors. And it turns out that when you're talking about COVID, staying indoors is about the worst thing you can do. All right. It's kind of silly to have to mention this, but I will. There are people that will say, oh, the only reason that cases are going up is because we're doing more testing. Except, if you look at Arizona, yeah, we're doing more testing, but mostly we're doing more testing because new cases are coming in. And also, as we do more testing, you would expect that the fraction of test results that are positive would be dropping. So if I say, okay, I'm just going to go out into the community and start giving people tests, you would imagine that since you're not selecting people who you know are sick anymore, that the fraction of tests that turn out positive would be dropping. What's going on in Arizona is exactly the opposite. What was it? Something like 6 weeks ago. Of the tests that were done in Arizona, roughly 3% of them were positive. Today, over 20% of the tests being done in Arizona are positive. And so the spike in cases in Arizona has nothing to do with the fact that we're testing more. And you can see that. All you have to do is look in the hospitals. Look at the number of hospital beds that are being occupied by COVID-19 patients. And here's what you see. You see that same curve of exponential growth in the hospital beds that we saw looking at cases. And so those cases reflect people are getting ill enough to come into the hospital. Everything I've talked about so far, what I've done is I've said, okay, let's look at it You can see, there it is, there's the exponential curve. Let's fit the exponential curve. What's the doubling time? Around 7 days, yada, yada, yada. Of course, the real situation is a lot more complex than that. And there are people who deal with that complexity. For example, there is the group at Arizona State University, the META-Z, which stands for Modeling Emerging Threats to Arizona group, who have been doing epidemiological models for COVID. And this shows their calculation, a paper that just came out a few weeks ago. I won't go into the details here. Basically, these different curves were under different assumptions for the summer effect. Remember that we don't have a favorable summer effect. The virus is just blowing on through the summer like nobody's business. And if you look at these models, what these models say we should be doing is something like this, which is in fact exactly what we're doing. So June 24th, there were almost, 2,270 people hospitalized, which puts us right there. We are on that curve. There's what's going on in Arizona right now. Just looking at hospitalizations. So this is not about testing. And you also see it in ICU beds. These are people who are getting sick enough. Once you go into an ICU bed, once you go onto a ventilator with COVID, then your chances of not getting out of that ICU bed are pretty good. When you get to that point, things are bad. What do you see when you look at ICU beds? You see that same exponential growth. Right now, our ICU beds are currently at 90% capacity. They're full. But that doesn't mean that COVID cases aren't continuing to go up. What does it look like if a week from now, or if a week from now there are twice as many new cases, and a week after that there are 4 times as many new cases? What does it look like when you have that many people beyond what the capacity of your medical care is? I don't know the answer to that, but we're going to find out. By the way, Arizona is a lot worse off right now than anybody, frankly. This is now normalizing it to per capita. So this is new daily confirmed cases per 1 million people. And here's Arizona, and here's the rest of the nation. So yeah, we are way out in front of everybody else here. The big outbreak that everybody has spoken of in the United States so far is New York. Man, that was New York. We're sure glad we're not New York, because that outbreak in New York was just horrible. Here's the outbreak in New York. This curve right here. That's it. New York locked down when they were down here below 100 new confirmed cases per 1 million people per day. Arizona right now is sitting up here at about 350 confirmed new cases per day. So we are in far, far worse shape than New York was at the time that they clamped everything down. And we're just letting the virus go. Wearing masks helps, but all of the studies that have been done say that you're not going to control what we're seeing right now by wearing masks. So there we are. That's what we're doing. Arizona is rapidly heading into uncharted waters. In the weeks to come, everybody in the world is going to be looking at us to find out just exactly how bad COVID can be. So again, what does it look like when you have 3 or 4 times as many critically ill patients as you have ICU beds? I don't know what that looks like. We're going to find out. In the case of New York, they had other states that people said, hey, we'll come to New York and help out. If you look at where we are right now, California is not doing well. Texas is not. who are we going to turn to help us with our pandemic? I don't know. Anyway, it doesn't look good, and we're going to start seeing that fairly quickly. I wish it weren't true. I have trouble wrapping my head around it. That's what we got. The timeline of COVID is long. Here we are in late June. And so I want to look at the timeline. Suppose that I were infected with COVID today. So today was my infection, day one infection. It takes something typically like 4 or 5 or 6 days before you get sick enough that symptoms really start appearing. Now, you have been contagious during that time. You're pre-symptomatic, you're contagious, you can give it to people. It's just that you don't have any idea that you have it. Then if you're going to develop symptoms, okay, you become symptomatic, maybe about there. After you become symptomatic, it takes a while probably before you get bad enough that you actually go into the hospital. So maybe if I got infected today, I'd present myself at the hospital after the July 4th weekend. From there, it can get pretty bad pretty quickly. If I'm going to get bad, not everybody does, although once you enter the hospital and are admitted, then you're on a path that doesn't look good. I find myself in the ICU maybe on, July 9th or something like that. So a couple of weeks or so out. Interestingly enough, I haven't even turned up in the statistics yet because it takes time for a reported case to actually show up in the statistics that you see. So I could well be in the ICU before I have even shown up in that daily graph for the day. Takes a while for the ICU admission to show up in the statistics. And if I'm going to die from this thing, which something like half of the people who go into the ICU do, I think, I don't remember the exact numbers, but it's very high. Once I find myself in the ICU, there's a pretty good chance I'm not coming out again. And I would likely die 3.5 weeks, three and a half weeks after my infection. If I survive, I'm going to hang around for longer. Anyway, that's kind of what it looks like. The point being here is that if I were infected today, I would still be sick and showing up in the statistics in late July. The people who are going to be sick when school is supposed to be opening are people who are going to be infected in the next week or so. All of this stuff is pretty much set in stone. Here you can see, of course, these were just typical numbers. This is now a calculation. Again, this was done by the MetaZ group at ASU. And what you can see, again, this is the fraction of people who wind up hospitalized. After 5 days, if you're going to be hospitalized, there's about a 50% chance you'll find yourself there by then. And if you are hospitalized, count on being hospitalized for the better part of a month. Hoping that you're hospitalized for that long, because if you're not hospitalized for that long, it means you didn't make it. And again, that crisis is set in stone. The people who will have COVID when school is supposed to reopen are people who will be infected in the next couple of weeks. And we're not doing anything serious to slow those infections down. So what are the implications? Well, this again is one of those model projections. Do various things, pick a number. Maybe there will be something like 100,000 infections in Arizona on the first day of school. That's probably low. It'll probably be higher than that. Arizona's population is 7.3 million, which would mean that about 1.4% of the population would be infectious. And if 1.4% of the population is infectious, then that means that if you've got a school with a campus of 1,000 people, you're going to have more than a dozen people on that campus who are COVID positive, who are sick with this thing. And that's not a good thing, because we're coming to understand a lot about COVID. There's a lot that we don't know, but we're certainly coming to get a better understanding of how it spreads. And I'll just read from this particular article that came out, about a week ago. And 6 months into the coronavirus, there's a growing consensus about a central question. How do people become infected? It's not common to contract COVID-19 from a contaminated surface, scientists say, and fleeting encounters with people outdoors are unlikely to spread the coronavirus. Instead, and this is a big instead when you're talking about schools, instead, the major culprit is close-up, person-to-person interactions for extended periods. Close-up, person-to-person interactions for extended periods. Crowded events, poorly ventilated areas, places where people are talking loudly or singing in one famous case, maximize the risk. I want you to look at that description of the place where it is easiest for COVID to spread and see if it reminds you of anything. Classrooms. It's hard to think of a better place for COVID to spread than a classroom. And last week I was having a conversation with a guy by the name of Jeff Vincent, who is at UC Berkeley, and he's actually a member of the panel on the National Academy of Sciences that is looking into trying to understand COVID in schools and things like that. And his statement was that there are all sorts of diseases that are passed around in schools. We know that. That's one of the reasons why viruses tend to die down in the summer is because kids aren't in school. And he said there was every reason to believe that children can spread COVID and no reason to believe that they can't. Wear masks. Masks are great if you're going to be out and around and, okay, I'm going to be at the store or something. Masks are not meant to give you, especially masks worn by kids, teachers, these are not healthcare professionals, are not meant to protect you from prolonged, continuous exposure to this highly infectious disease. So the idea that you're going to take something that looks like that and make it safe by slapping a few masks on people is just kind of nuttiness. Dozen or so people on your campus who are COVID positive. Many of those, probably about half, perhaps more, will be either asymptomatic or pre-symptomatic. They will be showing no symptoms. Take their temperature, do anything that you want, short of actually giving them a full-up test for the disease, and they're fine. They feel fine. They don't have a fever. They don't have any symptoms, nothing. But they are spreading the disease. They are shedding the virus. It's thought, this is a hard thing to wrap your head around, but I have seen estimates of over 40% of transmissions probably come from people who are asymptomatic. Which means that significant spread of the disease will occur at every campus that is open. I want to say that again. If you open a campus this fall, August, there will be a significant number of people on that campus who are COVID positive and won't know it, and transmission will occur. It's not if, it will. Which then leads to the question, What do? We would all love to see our kids back in class in the fall. We'd love that. That's clearly where kids belong. But how do you tell employees that they have to show up to work in an environment where you know they will be in regular contact with carriers of a deadly disease? A disease healthcare workers catch wearing the full PPE. Healthcare workers catch this and die of it. And you're going to send teachers and employees into that kind of an environment, knowing that there are multiple people there who are sick, who are carriers, who are capable of spreading the disease. How can you tell people it's safe to send their children to school? Especially, say I've got, grandma lives at home. She's immunocompromised. I send my kid to school. My kid comes to school. Grandma gets it. Bye-bye, grandma. It's not so much at that point about protecting the kids as it is about protecting the community at large. The thing about schools is schools are spreading centers for the community. If schools are opened, there will be significant numbers of people who die because schools are open. And most of those people will be people who've never set foot on a school ground, or at least not in a long time. So when you choose to open a school this fall, what you are really doing is you are choosing to put at risk members of the community who have no choice in the matter. That's what we're looking at. I simply do not understand how one can look at this. Again, if you start saying, well, gee, the future is going to be just like today, maybe you can make the argument that, yeah, we'll put masks on everybody and maybe it'll be okay, sort of. But the reality going downstream is that that's not what we're looking at. It's sometimes said that a single death is a tragedy. 1 million deaths is a statistic. We're talking about large numbers of sicknesses and deaths here. We're talking, even for those who recover, we're talking about people who have their health ruined perhaps for years and perhaps forever. People say this thing is just a little flu. No, this thing is not just a little flu. A single death is a tragedy, 1 million deaths is a statistic, except every single one of those numbers in that statistic looks like this.
More than 14,000 healthcare professionals have contracted the coronavirus in the U.S., and at least 27 have lost their lives in the service of others. One of them, Pamela Orlando, documented her own fight with the virus on camera before she died. Lead national correspondent David Begnaud has her story.
56-year-old Pamela Orlando was a frontline hero.
This is a woman who had everything to lose, and she still went out there on the front line saving lives.
The nurse from New Jersey worked 3 jobs. She was a breast cancer survivor and a single mom to 16-year-old Ryan and 23-year-old Reed.
I begged my mother to not go to work. I really did. I begged her, but that's not who my mom was.
Pamela worked at the Valley Hospital in Ridgewood, New Jersey.
Do you believe your mother was infected at work?
Absolutely.
From home, she started to document what would be the end of her life.
Today I have a fever that I can't get rid of. Day 2. Boy, do I feel like crap. Back pain, fever that won't break.
By day 3, she was hospitalized where she works.
Oh my God, this is no joke. I am so uncomfortable. My fever just broke, so I'm a little bit better. Fever of 104.6.
On the 5th day,
I feel horrible. Like so bad, like almost like I'm not gonna make it.
later in the day, she was struggling just to talk.
I can't even move without being short of breath. Just pray that I'm okay. Not sure what day it is. And I'm not getting better yet.
Pamela posted 5 more videos, but she didn't speak.
She was trying to log every day of the sickness to show the masses or whoever would watch it how this deathly virus can progress.
The day she died, April 16th, 24 days after she fell ill, Reed and Ryan visited her in the hospital, wearing proper protective equipment, along with their 80-year-old grandmother, Ann, who is Pam's mom.
She told my mom that she was going to take care of us and really protect us from anything. And that's what my mother really needed. She needed to know that me and my brother were going to be okay.
56-year-old Pamela Orlando died 2 hours after her boys went to see her. Gail.
David, that video is so tough to watch because you can actually see her slipping away. And what's painful to me is she probably knew she was slipping away, but yet she wanted to document this story in hopes of maybe helping others to let people know, as her son said, how bad this is. That's very tough to watch. And I feel for her sons who are watching this video and who she was.
You know, Gail, I spoke with a friend of hers who's a nurse at the hospital, and she said that every day she'd bring a phone to Pam's ear and she'd place it by the ear, and Pam was on a ventilator, so she was unconscious. But every time the boys would talk, her heart rate, which was beating rapidly, would drop considerably, and her oxygen levels would go up notably. And so that was a sign to the friend and the boys that Pamela could hear them loud and clear.
Yeah, and I think about the medical professionals too, David, who are now treating their own. As a medical professional, you don't expect to end up a patient yourself in most cases. And now many of them are in the hospitals as well. Thank you for sharing her story.
Bingo.
Thank you for sharing her story. It was very difficult.